reading disabilities, dyslexia, as well as mild to moderate reading disabilities, but this focuses on specifically dyslexia, which is the same as a severe reading disability. To define our terms, an inability to learn to read that is of undetermined origin. This inability is not caused by environmental factors, motivation, low cognitive functioning, or faulty instruction. That is the definition of dyslexia. Adolescents with severe reading disabilities, dyslexia, are in the 6th grade or above, but they have a listening comprehension scores within a normal range, but their reading levels are at the 1st or 2nd grade level. Adolescents are pretty easy to identify. How many are there? It is estimated that 3 to 5% of all students have a severe reading disability, and I prefer the term severe reading disability to dyslexia. There is much confusion over what that is. To extrapolate, Mankato Public Schools enrollment of 7,389, that would be 221 to 369 students with a severe reading disability. A school like St. Clair of 602 students, 18 to 30 students with a severe reading disability, an inability to learn to read that is of unknown origin. What about students with mild to moderate? Estimates anywhere from 10% to 20% of the student population. So going at the conservative extrapolation, Mankato 7,308, that would be 739 students with mild to moderate. St. Clair 602 students, approximately 60 students with mild to moderate. The effects for adolescents, academic success is far less likely. Students with severe reading disability are twice as likely to drop out of school. This severely limits their future earning potential, and they are more apt to be unemployed, underemployed, and incarcerated. It costs a lot less to attend to severe reading disabilities up front than to pay the social costs down the line. It costs a lot less to find a reading tutor or to support a reading center like the Capstone Literacy Center than to deal with the social and emotional effects. Not being able to read affects the development of students' identity, self-efficacy, self-esteem, self-concept, all of which are related to achievement and motivation within a school setting. Constant failure creates strong negative emotions, which are also directly related to learning and achievement. We emote and we learn with the same brain. If we're feeling failure, frustration, humiliation, we shut down. It's called downshifting. It is a healthy response to an unhealthy situation. Try to imagine what it must feel like. These students exist in a school where they experience frustration, humiliation, failure every day on a daily basis since the time they were in 1st grade. They have failed in a very public way. They are defined and are described by how far they are from average. Every class that has required a reading assignment was a reminder of what they were not able to do. To try to understand, think of a time in your life when you were a less able learner, when you just could not learn something. It could have been a musical instrument, a sport, a technique, a craft. What did it feel like when everyone else seemed to catch on and learn easily? Well, you didn't. Were you motivated to come to class? Did you want to continue? Did you want to practice outside the teaching session? Did you enjoy doing what you could not do? Would it help if someone just said, buckle up, put your nose to the grindstone? I think not. Reading disabilities, dyslexia, which is a severe reading disability, as well as mild to moderate reading disability.